Hi everyone, my name is Carol. For those who don't know me yet, I am the founder of Parentally, and Parentally is a platform dedicated to the well-being of parents. And what we do is we help new and future parents find all the extra care and support they may need during pregnancy, birth, postpartum, and their first years of parenthood. And we do so by facilitating access to professionals, also to community, and also by sharing relevant information. And this is exactly what we're going to do today with our guest, Emely Achterberg, who is a midwife at Verloskundigen Witsenkade, the other way around.
Very good.
And maybe it's best if I let you introduce yourself first.
Yes. All right. Thank you for having me here, Carol. Nice. I'm Emely, and I am a midwife. I work for around 20 years now, and I work already 20 years almost at the Witsenkade, together with two lovely colleagues of me, and we have our own practice. I started this job actually when I was 30, so I started to educate myself later. It was an old dream to be a midwife, so I did that in my 20s. I started to study this to be a midwife, and now I'm in the middle of Amsterdam, a midwife for almost 20 years. Yeah.
Lovely. And yeah, thank you so much actually for doing this live with us, with me. I must say before I start this live that in the past few weeks, we've had a lot of different comments about prenatal care in the Netherlands and not some very positive ones. So I think this is the perfect opportunity to kind of set the record straight and to debunk some myths about prenatal care in the Netherlands. Yes. Because I've also read some unsettling things and some things that just were just plainly not true. So it's really nice that you're here to tell us a bit more about midwife care in the Netherlands. And it's true that as a French who has given birth also abroad, the system in the Netherlands is quite different, quite unique. And what would you say for you is the most different? What is the approach and the philosophy behind the prenatal care in the Netherlands?
Yeah, it is absolutely different. I'm used to work with a lot of internationals as well as a client, so I know where from different countries they come from. And yes, and that's also nice to work with it because it's totally different. First of all, I think it's most different that you have a free choice where you want to give birth, and you can give birth at home, but you don't have to. And you can give birth in a hospital, of course, or in a birthing center. And it's more like the background goes a long way back. In the 17th century, there was education here in Holland to be a midwife already. And it's more like, you're not ill, you're not having a disease, you are just pregnant. And we are the gatekeepers as a midwife first. So that's your first point of contact to see, are you a healthy pregnant woman? Can you stay with a midwife, or do I have to refer you? We talk a bit later more about it, I guess, but it's more the background is that, you are a healthy woman and you don't belong in a hospital. That kind of thing is, if you have, beside of you want it, but it's more like that background, that it's different. And also we talk maybe later about postnatal, maternity care. We know, of course, I think best that it's also very Dutch, that you have somebody at your home to help you. And we as a midwife, we are medical responsible then that week. Sorry.
It's okay. Yes, and that's very true. I think that's one of the first things I heard when I got pregnant in the Netherlands is that you are not sick, you are just pregnant, and which is actually quite... No, but it's quite positive actually. It's a great way of viewing things. And when you say, indeed, you don't have to go to the hospital, but so it's the midwife who's going to take care of the prenatal care. I think it's quite interesting to know what kind of trainings do the midwives get.
Good to know. It's a 4 years education, like college education. So we are educated independently. We're not working under a gynecologist. We are educated totally by ourselves, but it's a 4-year study, and a lot of internships in hospitals with other practices. So you make a lot of hours, to get it. But it's a 4-year study.
Okay, and then is there ongoing training after the 4 years of study?
No,
or?
Of course you have to educate like a lot of professional medical field that you have to educate yourself and get your points, etc.
Okay.
Yes, we do, and we have to train yearly to resuscitate your little baby, and we are obliged to do some trainings afterwards.
I see.
Till the end.
I see.
Until you stop this job. Yes, so that's absolutely true.
And you touched an interesting point about the way the prenatal care is organized. So you said, like, if you are healthy, if you have a healthy pregnancy, it's the midwives who are going to take care of you. Could you tell us a bit more about that, about the different options?
Yeah, absolutely. When you know you're pregnant, you can just register with your midwife practice, and you can ask your GP or you Google where you feel comfortable with, or is nearby where you live. That's the most option for the most women that choose. But you just register, and first of all, you have an intake with one of the midwives, and that's in our practice 1 hour. And then we ask you a lot of questions about your medical history, your background, your family health, etc. And so we ask a lot, like, are you healthy enough to stay with us? Or do we have to refer you already because you have a high blood pressure, for example, in the beginning already? So that is an hour, and we give loads of information about how does this work, how we go further on, we make a care path. Is that the English word? I don't know, but we give you loads of information. It's about approximately 12 times, beside of all the ultrasounds, but 12 times that we see each other in a prenatal care. And the follow-up is about with us 20 minutes. So the next appointments are 20 minutes long. But for example, when we have to talk about birth, we do that in the middle of your pregnancy, then it's 45 minutes long to talk about your wishes and ideas and give you loads of information. So in the beginning, the frequent is not that often, but at the end of the pregnancy, we see all women every week. So it's close by at the end of pregnancy. And that's also, I think, nice of the Dutch care is that we are a practice of 5, and I think not a lot of midwife practice are much more bigger. But you're gonna meet us all during your pregnancy. So you know when you're getting labor, then you have a person you know, and we make a connection to each other. So in that around 12 times, when it's more needed, and it's absolutely more, that you meet us, all of 5 of us. So you make your connection with your midwife. I always say also in the intake, like, my core business is this baby growing well? Is this mother healthy enough, stays healthy, etc. And that's more like, is everything goes well, and also guide you not only to measure your high blood pressure or the blood pressure and feel your baby and do ultrasounds, etc. But also mentally, just a transition from to be a mother to a parent, for a human being, a woman to a parent, a mother. So it's a whole process you guide through for this 9 months about.
That was actually my question about the appointments that you get with the midwives, what to expect from them, because I've read and heard a lot of different things and also very untrue things. But yes, what can you expect from an appointment? What kind do you get? Testings? Do you get screenings?
Absolutely. Absolutely. Like the intake is quite the most important. In that way, Yeah, I say always if we get everything on track, we start everything up. So we give loads information how is the Dutch system works, because some people are there, where's the gynecologist, what are you doing here? I'm here in a midwife, but in America I see gynecologists directly. So we explain that a lot, like, okay, you can go to a gynecologist. It's not that you're not allowed to, but it's more like we explain, like the gynecologist would say, what are you doing here? You're a healthy woman. And we as a midwife are in that first point of contact and the first intake for about an hour, a gatekeepers. That's the most important rule at that moment. How is your family history? So we ask you loads of questions about your medical history. Are you healthy? Did you have diseases when you was a child? And yes, then about the Dutch system to refer, how does it go, so give shortly information about birth as well, of course, but also prenatal testing. That's important. And it's around 8-9 weeks that we have an intake. And that's sometimes together with an ultrasound as well. I can make that as well in the beginning of pregnancies. So we combine it sometimes. And about the prenatal tests, we are the counseling the parents, to guide them to make a well-made decision, what you can do, and to choose for what you can do for prenatal testing.
What are the standard prenatal testings that are offered?
We do the NIPT, the non-invasive prenatal test, and that's a test. We give them the loads of information and also on paper, of course, but we counseling about that you can choose for this test. It's quite an easy test to do. It's a blood test. It's not invasive for mother or child. And we check your baby on 3 syndromes. Syndrome of Down, syndrome of Patau, or the Edward. And there's a kind of a DNA of the placenta in the blood of the mother, so they can check that in the lab, if it's there or not. And it's an easy test. You just go to the lab, but you have to think about it, of course, and we guide it through. Why do you testing? And what is the reason that parents, mother, father, together, whatever, make the decision together? Like, okay, what are we choosing for? And the NIPT is paid by government, so you can just do it. But it's important that that you inform well, you're counseling them well. Nicest of that test is why it's just only blood research. If the outcome is very good, then it's 99.9% it's a good outcome. So that's give you secureness.
And this is a test that you decide to take or not, right?
Exactly.
It's not like, but
it's
I understand.
Always, and that's your free of choice. It's your own choice. Everything actually in birth and in pregnancy. It's just that we are also the important, to guide you and to inform you, and you decide what you want to do. But that you have the right and good information, of course.
Are there tests or screening that are mandatory? Like I don't know, for the diabetes,
it's always a choice. But yes, we inform and we advise that maybe when you have high risk for developing, for example, diabetes, because it's in your family, then yes, then we advise and we talk about it. But it's always a choice, and we just give the risk, to see what could it be. But it's always a choice.
I see.
Yeah,
I understand. And talking of choice, actually, let's talk about birth, because yes, like you said, a lot of people think that you are pregnant in the Netherlands and you have to give birth at home, which is kind of scary. Exactly. Can you tell us a bit more about that, about the options, how it works when you're in the first line or second line, or this kind of aspects?
First, about that line, so we call that the first line, the first tier in the Netherlands, and we have a second tier, and actually we have a third tier. It's more like the first tier is that you, with a midwife, you have low risk pregnancies, maybe a little kind of small complications, but not that big that you have to go to the gynecologist. And then you have the second tier that you have to have care of the under the gynecologist. For example, then when you have a twin, or you have a breech position at the end of pregnancy, or high blood pressure, that are reasons to give birth under the responsibility of a gynecologist, and not with us. And then you have the third tier as well, and that's more the academic hospital, and that's for if you have a triplet, for example, then you have more care there. But we make that referral first in the intake. Of course, when it's a twin, I make the scan. Oh, it's a twin. Congratulations. Then I refer you to the hospital, to the gynecologist, also of your own choice if possible. But then that's also working with birth. It's a way like when you get in labor. And that's also the midwife. We are 24 hours the whole year, reachable for the first point of contact. So also when you start in labor, to 10% starts with the membranes who breaks, or the 90% starts with contractions. That you phone a telephone number that you get, of course, and then we visit you first at home. We always visit first at home. How the baby's going with these contractions, how the mother's doing, what are the wishes and idea, to listen to the heartbeat of the baby, to feel the dilation, and what are the wishes at that moment. Actually, at that moment, maybe somebody who wants to give birth in a hospital says, I don't want to go home, I go out anymore, I stay at home. Then we stay at home at that moment. So you make step by step the decision during labor. When you want to have an hospital birth, we arrange that as a midwife at that moment. And that we call a polyclinic birth.
I see.
That means you go to your hospital, what at that moment there's place, and you go there by taxi or Uber, and the midwife will always wait, or we do that you get in the Uber. And that's also I work for 20 years, I never was ignored, so there's always taken by a cab driver, but you go there or by own car. Then the midwife will come as well. We go together there. We see each other there in that hospital, in a room. The hospital knows that you're coming, and then we have the birth further on in that room with a nurse who is next to me to assist us. You kind of rent a room.
I see. I see.
Yeah.
I see. And so this is what you called polyclinic birth. So it is, you give birth in the hospital, but it is your own team of midwives who is there with you in the hospital.
Exactly.
Okay.
So there's no doctor inside. There's no other nurses coming in. It's your own room. Yeah. With an own shower and the bath if needed.
And what you said is that, I don't know, let's say the labor starts and I had decided to give birth at home, but then I want to go to the hospital. This is an option. I can decide to go.
Absolutely.
Okay.
Yeah.
I see.
And of course, when you have 9 centimeters, and I think, this is going fast, and then we stay at home. And so that happens not that much, but sometimes, sometimes it goes quicker than we think. Yeah.
And I think another very interesting and important topic is pain relief. What are the different options? Because you hear a lot of people saying you cannot get the epidural, whatever.
Absolutely. And that's also, it's still there.
There is actually
that thoughts like, pain relief, it's not possible in Amsterdam or in Holland. And it is not true. I mean, that's a big cultural background from the Dutch obstetrics. Without painkilling, my mother's did, but nowadays you can have painkilling, and it's there. You can have it, no problem. There are a couple. First of all, what we can do as a midwife, we give a couple of things, like not that much, but we can give you a TENS machine. Maybe you ever heard of it. You can rent that with insurance or buy it by yourself, but that's a kind of a stickers on the back of your lower back, where you have contractions in your lower back, that could help you to block the pain sensation to your brain. What we do as a midwife, we also try the bath or a shower. Warmth will help you to put the pain release a bit more down. And we have gas and air, but not that much in Holland, or what I know in Amsterdam. It's more like there are 2 places in Amsterdam where you can have that. But that's also possible that we use as a midwife, but that's always in a hospital place. But we have gas and air 2 places. But then, yeah, that's possible what we can give, and then you have the other options, and then you have stronger pain reliefs. We have remifentanil, and we have the epidural.
Okay.
And then we refer you to the hospital or to the care of the gynecologist. So if you have a polyclinic birth with me, and during the labor you think, I want something against the pain, then I arrange that at that moment. And then the doctor come in, and then I'm leaving. So we switch over the responsibility.
Okay, I think that really answers the question we had in the comments from Vidmantem, who said, are you providing also epidural then in polyclinic? Then the answer is yes, but then the care is transferred to...
You stay in that room.
Yeah.
But, the people, the person switch is over there then. And yes, that's possible.
And then...
And these...
Yes, go ahead, sorry.
No, these kind of painkillings, the remifentanil, the morphine, and the epidural, it's more under care of the gynecologist, because it could affect the baby, but it's more that we have to monitor your baby constantly, and that's what we do as well as a midwife, but not constantly. And then we call the CTG, that they monitor totally the rate of the baby, the heartbeat of the baby. So that's why the responsibility goes over to the gynecologist. And that's what we leave. Yeah.
I see some questions in the...
how far you are in the process, of course. But yeah.
I see some questions in the comments, and I think if we have enough time, we'll answer them at the end of this live. But I just wanted to go back to the gas and air.
Yeah.
You said it's available. Where is it available exactly? Where can you get that?
Like in the OVG West Hospital, in the Buffalo Center West, and in the Amsterdam Hospital. These are the 2 spots where you can have the gas and air.
And if you give birth in a birthing center?
Yes. Sorry, the birthing center in South. Yeah, we have also the 2 birthing centers that we can give gas and air. It's there. You go there, we can help you. Yeah.
And if you want to give birth in a birth center, is this something that you have to arrange in advance, or can it be also kind of a last-minute decision?
Absolutely. At that moment when you're in labor, and there also has to be space.
Yes, of course.
Yes, you don't have to make a reservation because we can't do that. We can't plan this birth, but we arrange that at that moment. Yeah.
And you mentioned another option, remifentanil.
Yeah.
I don't know. What is it exactly?
Remifentanil is kind of an IV drip with a morphine in it, and you put your own on a button. And it makes you more. You still feel contractions, but it's less intense. So the pain sensation, it's going down. It's more that you can actually more relax and more calm and relax between the contraction as well. And you cannot overdose yourself. So that's also nice. And it works about 4 or 5 hours. So we don't give it too early. Most of the time around 5 centimeters is nice to get. And it's like, it makes you relax more. Yeah.
And I have a practical question actually. When you feel you are in labor, when do you call your midwife? I know this is something you yes, exactly, during the appointments, but
no, prenatal we give. We have a video. We have everything on paper. We talk live to each other with which wishes there are. But with your firstborn baby, your phone is the guideline, like every 3 minutes, 1 minute long contractions, and that for at least an hour. Then there's something happens. The most of the time, something on your cervix. So then we have a regular contractions, and then we come in and to check. Of course, when you need us earlier or whatever, or you doubt, then you can phone us always. And the second baby, we give you more the information every 5 minutes. Contractions 1 minute long, 1 hour long. That are the information we give for when you when you call a midwife. And of course, when the membranes breaks, that's also a reason to phone.
I see.
Yeah.
Just before we move to the next question, which is about postpartum care, there was a question in the comments by Policia, who says, why does lady have to leave the hospital after 3 hours after birth?
Why?
Is it possible?
Oh.
Why do women have
Why?
to leave the
Yeah.
hospital after 3 hours after birth? And is it possible to stay longer?
Yeah. It depends very how you deliver. If you have a cesarean, you stay one more night. If you have a bit more blood loss than average, you stay longer. They don't. But if everything went well, and it's not 3, it's 4 hours, you first have to eat, to shower, breastfeed, golden hour. We're not in a hurry, and it's not like. But everything goes fine, then you go home, and that's the nicest thing. You have maternity care. And a midwife who's always there 24 hours on the telephone if needed. Most of the time they not, you deliver at 12 o'clock in the middle of the night, you don't go away at 3 at night,
Yes.
but then the next morning. But that's your back home in your own environment, in your own bed, with the care of the maternity care. Because there's no reason to stay because everything's fine. Yeah. So about 3-4 hours the most of the time, something 4 5, I think. Yeah.
And actually, yes. What is the role? Because there is the Kramzorg, the maternity nurse, indeed. And then, what is the roles of the midwives after the birth? Do we still see the midwives?
Yeah. Yep, definitely. We are medical responsible that week as well as a midwife professionally. So if there's something not going well, the temperature of the baby is not good, too high, too low, breastfeeding's not going well, we are make policy. We talk to each other how to do, but there's a wonderful care of the maternity nurse who's there every day, at least 3 hours, and guide you through from how do I temperature a baby, how do I breastfeed, to how do I put a baby in bath. As a midwife, we visit as well that week, around 3 times in that week, and we are 24 hours reachable for questions. For also the maternity nurse have to discuss if something's not going that well, then they phone us as well. So that takes about 8 days, and we are there to guide you through as well and visit you and talk about how the birth went, and but we are responsible.
So yes, it's just to answer the question that was in the comment. It's not like you go home and you are alone. You have a team for you and a nurse who is taking care of you. And the Kramzorg, we have another episode, another live about Kramzorg. So for people who have questions about this, I would encourage you to listen to it. But if there was one key takeaway, is that the Kramzorg is a maternity nurse, is a medically trained professional. So you are not left on your own at home.
No, absolutely.
And there was another topic that I wanted to talk about is the C-section, because we got a lot of different questions. And the first one was, is it possible to ask for a C-section, to have an elective C-section?
Absolutely.
Yes?
We get that question regular base. And I know that's also a cultural thing.
Yes.
In other countries, in Brazil, it's quite common to have a C-section. And in Holland, it's not that common. But yes, you can have.
Really? Okay.
To ask, and then I refer you to the hospital, and to explore why is that. Is there a lot of fear? Is there a lot of culture backgrounds? So you have a talk with a gynecologist and also a psychologist to have to just explore why you want this decision, and that you're informed by the gynecologist. What are the risks? It's an operation, and all the pro and cons to talk about it. Yeah, but it's not that it will not ignore it. Absolutely.
I see.
Yeah,
I see.
You can always ask, and that's also the Dutch system. You can ask everything, and just we have time for it to talk about it in a way like, where it comes from, what is your, sometimes needed.
I understand. And then if you have a C-section, how long is in general the stay in the hospital? Is there a minimum time?
Yeah, depends. if it's an elective
Mm-hmm.
C-section, it's also different when you have a later on during labor C-section and how you. But most of the time, after 24 hours that you go home.
Okay.
24 hours.
Okay.
Hours 48, depends how things going.
Okay, that's good to know. I think we've covered all the most important aspects of prenatal care, but my last question is is there anything specific, any social or cultural aspects that mothers who give birth in the Netherlands have to be aware of or to be mindful of?
That's
in your opinion?
Yeah,
it's a complicated question.
Yeah, but I think it's take it step by step. Ask everything, especially you're not known with this. Dutch healthcare system is so different than other countries, so it's more like feel open to explore, and that's what I also see. That your changes in that 9 months, like, oh, this is nice of this system, or this is not nice, of course, but ask, just get to talk with your midwife and about if you're insecure about it still, that but it's, I don't know other systems, of course, that well. I've not experienced by myself, but I think it's nice because you have time and you grew in it and get confident with this. And that takes time, but please open for it and ask when it's not clear. And also when your wish is epidural, it's okay, no problem. We don't have any preference. We arrange it for you, but it's more that you're informed well. So ask that information, but that's, I think, my job, to inform you well, that you can make your own decisions. Yeah.
That's really great to hear, because you often hear different sounds and different bells, but it's really nice to hear it from you that there are options, and that discussing the options is really the way to go. And when you don't know, ask. And
exactly.
That's what the appointments are for.
That's a part of the big part of the appointments as well. That it's not only check your blood pressure, but also like, feel confident to get in this process, to get a mom, but also to get in this process from this system.
Great. Before we finish, I think it would be nice to learn more about your practice, how you function, where you're located, all the different things.
We are located as the midwives of Witsenkade in the center of Amsterdam, on the Nicolas Witsenkade, and on the Jordaan.
Okay.
On the Jordaan, we located as well. So, and I work with my colleagues already, I guess, for 18 years together.
Yeah.
So that's quite a long time with lots of Larry. It's a practice, actually, I think it exists about 45 years already.
Wow.
So it's quite an old practice in Amsterdam. We work a lot with internationals in the center of Amsterdam. I think it's the most important. What I just want to say, we inform, you decide. That's our vision, and give you the best information what we have and experience. And I think that's the most important thing, that you feel confident. It's you're getting a child. You're not going to the bakery to buy bread. So it's good to have that you feel confident and free, and to ask us everything.
That's really nice to hear. Thank you so much, Emily, for giving us your time to share all this knowledge and insights. If you have 5 more minutes, maybe we can go through the questions. If there were any questions in the comments, but I think we've covered them all. Let me just double check. I think we got them all. One question about the tests. Why don't you offer the toxoplasmosis test or the blood exam at the end of the pregnancy? And why you do not arrange an appointment for a possible anesthesia during the birth? That's very specific. Yeah.
The toxoplasmosis, you can also check it.
Yes.
That's not a problem. So it's more like, we don't do that common, because it takes a time to see it in your blood if you're infected, and you can reinfect in a way, like it takes sometimes 3 months, 90 days that you just see it in your blood, but you are infected already. So that's also very Dutch. We are more preventive.
Okay.
So don't eat raw meat.
Mm-hmm.
But if you want to check it, we can do. But then you have to check it a lot of times. Oh, that's my computer. But then you have to. Then you have to check it a lot of times in your pregnancy.
Mm-hmm.
So that's why we do it not common.
Mm-hmm.
And the other was the anesthesia.
Why is there not anesthesia appointment during birth? But I'm not sure exactly.
It's more like before birth, you mean? Yeah, because not needed, because maybe you don't need the doctor to have that. There are some protocols that you have to need it because you have sometimes a surgery on your back, or you had problems with your back that you maybe can't get an epidural, but that's what you told the midwife, and then we arrange an appointment. And during birth, that's not only when you need an epidural, then we need that doctor to place it. And that's there 24 hours in the hospital. And that takes a time, because first we have to confirm that your baby's healthy for 30 minutes. And then we make the referral, we phone the gynecologist already. So that takes some time, with 1 hour sometimes, that the doctor is there to help you with the epidural. But yeah, before, there are not much reasons to do that.
I understand.
An appointment.
Yeah. And you mentioned something very important, I guess, which was also my case, is that it takes time to kind of set up the epidural, and that's sometimes it's a bit too late.
Sometimes.
It's like, that when you ask it, you cannot get it anymore because you wouldn't have time to get it. This is what I got as an answer when I asked for one, but I was already way too advanced in the dilation. And then they told me, it's going to be complicated because you're going to give birth anytime soon. So and I think that's what people also say, like, you cannot get. It's not that you cannot get the epidural; it's that
it goes just quicker than you thought.
Yes, exactly.
Exactly. And then sometimes remifentanil could help you for the last centimeters. But when you go much quicker than we thought, and you get the epidural, then the baby's already there. It takes 1 hour, because first we have to confirm, is this baby healthy enough to get the painkilling? Yes, and that sometimes happens, especially with a second or a third child, that it goes a bit more quicker than the first one, and that you are too late. It's not because there was delay, but there is because the body goes quicker.
Yes, that's what I meant.
You're at the end of the dilation, actually. You almost start to push. Yeah.
Exactly. Well, I think we've covered all the most important aspects, and I thank you so much for doing this live with me, Emily.
Nice, thank you.
We've learned a lot,
I hope so.
And I hope everyone who watched also found this live helpful. It has been recorded, so we will share it on the feed very soon, also with all the information that Emily talked about. And of course, if you have any question, you can contact us, and you can contact Emily directly. I will put all our contact details in the caption of the video when I post it. Emily, is there anything else you would like to add before we finish this conversation?
Thank you, and I hope you have some information, and always ask if there's something not clear. Thank you.
Thank you so much. Thank you everyone who watched. See you soon for a new live, and have a great day. Goodbye.
Bye.